I am a teacher. I used to be able to speak in front of my students, but recently I have been feeling nervous and anxious when I'm teaching, and this has affected my daily work negatively. I would sweat constantly and find my hands trembling with just the thought of being in front of the classroom, giving a lecture. I would lose sleep at night with flying thoughts in my head. Sometimes, the same scene replays in my head over and over again, thinking that I should have been better than who am I now. The thought often makes me feel inadequate and unworthy. These days, things are just getting worse and I feel like everything is just too much to process. I'm physically and mentally exhausted of my situation, to a point where I would have difficulty to eat, sleeping, socialize during course and other leisure activities. I decided to visit a psychiatrist and I was diagnosed with generalized anxiety disorder.
Anxiety. Anxiety is the human body's natural response to stress or perceived stress. Oftentimes, it comes with a feeling of worry, uneasiness, or fear. While it is normal to experience some level of anxiety in certain situations, like in a big exam or a job interview, people with anxiety disorders tend to have these feelings excessively or persistently without any special occasions. The cause of anxiety disorders may vary from person to person, such as experiencing a traumatic event, build-up of stress, or family history, as anxiety can run in the family. There are different types of anxiety disorders, which may be characterized by the symptoms or their cause of anxiety. Examples of primary common anxiety disorders are generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, and post-traumatic stress disorder, known as the PTSD. Generalized anxiety disorder is the most common type of anxiety disorder where one suffers from prominent worries and anxiety about several components of one's life. People with GAD may show hyperarousal symptoms such as disturbed sleep, associated fatigue, lack of concentration, irritability, and muscle tension. In order to obtain a cure for anxiety disorders, we have to look at it from the point of view of brain chemistry, where there is an imbalance in the brain's chemicals such as serotonin, norepinephrine, and GABA. These chemicals play an important role in controlling our emotions and feelings. Research has shown that the imbalances in certain neurotransmitters such as serotonin, norepinephrine, and gamma-aminobutyric acid GABA have been associated with anxiety disorders. Serotonin regulates mood, while norepinephrine is associated with fight-or-flight response. GABA is an inhibitory neurotransmitter that helps to regulate anxiety. Disruptions in these neurotransmitter systems can contribute to the development of anxiety disorders. People with anxiety disorder are found to have abnormally low levels of serotonin and GABA neurotransmitters and a high level of norepinephrine. Serotonin plays several roles in our body, including learning, memory, happiness, and regulating our body's temperature. A lack of serotonin is thought to cause depression, anxiety, and other health conditions. Meanwhile, GABA is known for producing a calming effect in the body. It is thought to play a major role in controlling anxiety, stress, and fear. Decreased GABA levels are associated with several neurological and psychiatric disorders other than anxiety, such as epilepsy, schizophrenia, or autism spectrum disorder. Meanwhile, norepinephrine are responsible for the adrenaline and energy pumped through the body when a person is stressed or anxious, which can cause changes like rapid heartbeat and sweating, which are some of the symptoms observed in people with anxiety. Now that we know the cause of anxiety disorders and the science behind it, we can better understand how anxiety medications can help with anxiety disorders. These medications can relieve and prevent anxiety symptoms, and it is more effective when the anxiety medications are used concurrently with cognitive behavioral therapy, CBT, which is the best form of psychotherapy to treat patients with anxiety. Various medications can be prescribed to patients with anxiety disorders. In general, these pharmacotherapy interventions offer rapid and significant improvements to anxiety conditions. However, they are also associated with various side effects, which may differ according to each type of medications. Hence, psychotherapy like the CBT is usually recommended as the first-line treatment option for patients with mild symptoms that do not require pharmacotherapeutic interventions. It is also crucial for doctors to decide the choice of treatment and medications carefully, taking into account of the patient's health conditions and background, and most importantly, the pros and cons of each medication prescribed. The SSRIs, known as selective serotonin reuptake inhibitors, and SNRIs, known as serotonin norepinephrine reuptake inhibitors, are often used as the first-line treatment medications for anxiety and are taken daily. SSRI and SNRI mainly act to balance the brain chemicals causing anxiety in the brain. For instance, SSRI increases serotonin levels, while SNRI increases both serotonin and norepinephrine levels in the brain. This is achieved by inhibiting the reuptake of these chemicals into the neurons, allowing it to act in the receptors of action persistently. These medications are effective for long-term treatments and help relieve anxiety symptoms such as irritability, agitation, frequent crying, and excessive worry. Meanwhile, tricyclic antidepressants, which are named after its three-ring chemical structure, such as imipramine and mirtazapine, may also be used to treat anxiety disorders. These medications can help to treat depression symptoms, which may occur together with anxiety in certain patients. However, tricyclic antidepressants are contraindicated or intolerable for some patients due to some side effects to be discussed further. On the other hand, we also have adjuncts that are also used together with specific SSRIs to boost their therapeutic effects. Adjuncts may or may not be prescribed according to the patient's conditions. Examples of adjuncts to be used to treat anxiety are benzodiazepines, buspirone, hydroxyzine, and propranolol. SSRIs are used to treat anxiety disorders. The examples are fluoxetine, escitalopram, fluvoxamine, paroxetine, and sertraline. These are the 5 most commonly used SSRIs. They can also be used to treat depression due to their mood-stabilizing effect. Fluoxetine has the longest half-life, which is the time taken for a medication to be cleared from the body among all SSRIs. Thus, there is a lower incidence of discontinuation syndrome caused by fluoxetine. Discontinuation symptoms are a range of symptoms that may occur in patients taking SSRIs or SNRIs after stopping quickly. These symptoms include insomnia, which are vivid dreams, anxiety, and nausea. Fluoxetine can help anxiety patients to recover from depression, fear, and boost their energy. However, due to the long half-life, the product of these drugs after being processed in the liver may accumulate to cause liver damage. Patients' medical history should be considered as the interactions with fluoxetine with the liver enzymes, which is CYP450, may affect the ability of the liver to process the other medications, which may lead to toxicity. Paroxetine is the most potent SSRI, providing therapeutic effects even when taken at a low dose. This drug is rapidly absorbed in the gastrointestinal tract to have a faster onset. The sedating properties of this drug help patients with insomnia due to anxiety to sleep better at night. However, the drug will likely cause side effects such as lower sex drive, weight gain, and seizures. Sedation may be unfavorable in cases where daily activities during the day need to be carried out, such as working or driving. Fluvoxamine has the shortest half-life among all SSRIs, and it can be used to treat obsessive-compulsive disorder, OCD, which is a type of anxiety disorder that features a pattern of unwanted thoughts and fears that cause repetitive behaviors. It is also a recommended pharmacotherapeutic treatment option for adults and children with other anxiety disorders. On the other hand, fluvoxamine cannot be taken with caffeine as it inhibits the liver enzymes CYP1A2, which metabolizes the caffeine, leading to caffeine intoxications and other drug toxicities that requires the metabolism of this class of liver enzymes. Sertraline is safe to use during pregnancy, which is helpful for common anxiety disorders in pregnant women. Doctors would also opt for sertraline as a treatment option for how to treat anxieties, such as panic disorders. The benefits of using this medication is that it is less sedating compared to paroxetine and has a weaker liver enzyme interaction. Thus, it is relatively safer to be taken with other drugs. However, sertraline must be taken with a full stomach to prevent gastrointestinal side effects such as diarrhea, nausea, and vomiting. Escitalopram, on the other hand, has a lower overall inhibition of the CYP450 liver enzymes and thus can be used safely with other drugs. A number of our clinical data have indicated that escitalopram is generally effective and well tolerated. The cons of escitalopram comprises the dose-dependent side effects such as heart rate prolongation, known as the QT prolongation, drowsiness or insomnia, sexual dysfunction, and gastrointestinal side effects such as diarrhea, nausea, and vomiting. Moving on to SNRIs that are commonly used for anxiety treatments, including venlafaxine and duloxetine. Venlafaxine has minimal drug interactions with almost no CYP450 activity compared to other anxiety medications. It is suitable for patients who take multiple drugs due to multimorbidity. Multimorbidity is commonly understood to be the coexistence of multiple health conditions in an individual. It is also suitable for elderly populations because of its short half-life and fast renal clearance, which can avoid the buildup of metabolites in the body. However, dosage adjustments may be required in patients with renal impairment. It may also cause dose-dependent side effects such as high blood pressure and QT prolongation. Thus, it should be used cautiously for cardiovascular patients. The other side effects of these drugs include some side effects mediated by the increased level of norepinephrine such as dry mouth, constipation, nausea, dizziness, somnolence, and insomnia. Duloxetine, on the other hand, shows lesser blood pressure elevation as compared to venlafaxine. Duloxetine is also used to treat different types of pain such as side-beating nerve pain, fibromyalgia pain, chronic lower back pain, and chronic osteoarthritis knee pain. However, side effects such as weight gain or loss, excessive sweating, and sexual dysfunction may not subside and can persist as long-term side effects with the use of duloxetine. As duloxetine is a delayed-release drug, some of the essential counseling points for patients to take note of includes swallowing the whole capsule without crushing or chewing to ensure its delayed absorption efficiently in the intestine. Next, tricyclic antidepressants like mirtazapine is effective in treating obsessive-compulsive disorder (OCD) and anxiety. It can help to increase appetite, useful for anxiety patients who commonly lose appetite and weight. Its sedating effects may be useful for anxiety patients who are experiencing insomnia, and it also shows fewer side effects on the gastrointestinal system. However, due to its strong sedating effects, it is only suitable to be taken at night before sleep. Other downsides of these medications include its side effects, which can cause low white blood count and sodium levels. Now let's talk about adjunctive treatment medications used in anxiety. Alprazolam is one of the benzodiazepines that is commonly used as an adjunct treatment for anxiety pharmacotherapies. It is a fast-acting drug which exerts immediate effect within an hour. Therefore, it is helpful as a combination therapy with SSRIs and SNRIs to control the anxiety rapidly, as the first-line treatments can take several weeks to work. However, it is highly addictive as it can cause rapid tolerance development and takes time to detoxify. Thus, it should not be used as long-term treatment. It also should be avoided for elderly as it increases fall risk in elderly due to the side effects such as drowsiness, dizziness, and low blood pressure. Hydroxyzine is an antihistamine drug that can be prescribed to treat anxiety. Unlike benzodiazepines, it is not considered addictive, and it is helpful for insomnia related to anxiety due to its sedating effects. However, it is not a safe option for those who have a history of long QT prolongation. It is also not recommended in patients over 65 years of age due to the potent anticholinergic side effects such as confusion, dry mouth, blurry vision, constipation, urinary retention, and decreased perspiration and excess sedation. Pregabalin, on the other hand, shows rapid onset of action. It is not considered addictive in the same way as benzodiazepines, thus, it can be advantageous for those individuals who are at risk of substance abuse or dependence. However, it is contraindicated in kidney failure patients to avoid toxicity because it is more than 90% excreted renally. It may cause serious allergic reactions including angioedema, which can be life-threatening and require immediate medical attention. Propranolol is a beta blocker that is commonly used as an adjunct to treat anxiety. It has two major advantages over other classes of anxiety medications by which they are not addictive and do not have cognitive side effects. It helps to elevate some of the physical symptoms of anxiety disorders such as rapid heartbeat, sweating, dizziness, trembling hands or voice. In contrast to its benefits, initial research from years ago showed that these medications could worsen depression and is contraindicated for patients with heart failure, bradycardia, or asthma. It should also be avoided in patients with low blood pressure. In the society we live today, anxiety disorders are more and more common, but it tends to be neglected. The low awareness and treatment reach of this psychiatric condition is dangerous as anxiety is associated with high morbidity and suicide risk. It's never enough for us to emphasize the importance of seeking proper help to cure mental illnesses and raise awareness against mental health. With the proper help of therapy or treatment, such as medications discussed earlier, people suffering from anxiety can cope better and eventually recover their original confidence to thrive in life. Once again, this video is only for educational purposes. Do not self-diagnose and seek proper help from medical professionals for the best outcomes and your own safety. If you are suffering from anxiety, all you need to do is take a bold step to reach out for treatment. With that, here comes the end to our video. Thanks for watching.